How we doing? Are we ready? Ready? Good. Thank you all for joining us today. I'm joined again today by the Secretary of Health, Kim Malzum-Risden. Also wanted to talk a little bit about Smithfield. Hopeful that they will produce a plan this week. The Department of Health stands ready to assist them as they plan for reopening, and we will have widespread testing available to help keep the plant open and running when they are ready to do so. In testing capabilities, as the state of South Dakota stands today, is we are 19th in the country for testing per million, the second highest in the region. This means that we will have a plan for broader, more widespread testing in the future, that we're doing well today, but we're only going to build on that. And that also, I want to remind everybody that as we do more testing, we will see more positive cases as well. This morning I had a phone call with our mayors in the state and talked over what they're seeing on the ground in their communities and some of the plans that they have for local events there and some guidance. Many of them are having city council meetings this week or county commissioner meetings in their area, and I informed them that I would be giving them more guidance in the next day or two as to what my recommendations would be that they could follow in the coming weeks to come. I had a phone call with the president and the other governors of the country right before I came over here. A lot of discussion over increased testing capabilities, our lab capacities in our states, that people are being aggressive in taking care of folks. Also some discussion about flexibility in federal revenues and how we could utilize those to fill revenue shortfalls. So all in all, it was a good discussion, and I appreciate the president and the vice president and the task force for facilitating that kind of conversation as well. Tomorrow, I'll be giving the state a back to normal plan. It will look at the executive order that we have in place and some changes and recommendations going forward. As more people go back to normal activities and daily activities, this virus will spread more. There will be more positives, which is just a fact that we need to realize will happen. From day one, though, we have been focused on our hospitalization rate. That's what we'll continue to do, is as we see more positive numbers, we're going to continue to track how many people are in the hospital that need more acute care to really judge where we're at and how we're doing in the state of South Dakota. Right now, today, we have 61 people that are in the hospital. We're prepared for that number. We're also prepared for many, many more, and know that we could see many more in the hospital in the days to come. We're in that position, though, of handling what we have today because of the great work of so many of the people in the state of South Dakota. If you are concerned about getting sick in the coming days, just know that you can still stay home. If you're uncomfortable with where things stand in your community and people out and about and moving around, just know that you have the ability to still stay at home and protect yourself and your family and your health. I want to encourage everybody to continue to download the Care19 app. That's incredibly helpful for a lot of folks to track where they have been and to give to our Department of Health and officials should you happen to test positive in the future. And again, every single day, covid.sd.gov is updated, and I'd appreciate everybody going there for new information that's posted every single day, whether it be public health issues, if it's economic help, if it is mental health resources that are available to the people in the state, and then updated case information. So with that, I will open it up to any questions that you may have.
Governor Bob Mercer, KELOM News. As part of your back to normal plan, do you intend to restore elective surgeries in hospitals?
There's discussion about how we would deal with elective procedures in our back to normal plan. There will be many different entities that will be addressed, and we'll give guidance on that tomorrow when I release that. One of the key things to remember, Bob, and I would encourage everybody to remember, is that these healthcare providers that would need personal protective equipment would expect to be getting that for themselves and working on that supply chain as well. We've had a lot of questions into the Department of Health on if we will be supplying that for them and all the different dentists or orthodontists and those individuals, and that's just not something that can be done. They will need to secure those supplies themselves. But we'll give more guidance on what that looks like tomorrow.
Hi, Governor.
Yes.
On your website now has cases broken down by demographics. And I noticed on there that 20% of the cases are classified as black. And yet in the state, only about 2.4% of the population fit that classification. So I mean, can you explain why that is?
So the question is around racial breakdown of the active cases or the cases that we've had. And so, yeah, 31% of our cases so far have been among white people, 20% black. That would be a higher rate than our actual population would show. I think if you look at where we've had a lot of cases, it's in our more diverse communities and, just tied to the diversity of those communities.
I mean, are a lot of those people workers at the Smithfield plant?
I can't speak specifically to Smithfield, although, we've talked a little bit about the need to, use interpreters to work with many of the individuals that work at Smithfield. I think there's something like 70 dialects spoken there. So again, a very diverse workforce there. On a rare bit of good news, the American Indian rate is 4%, so that's actually less than what their population density would indicate.
Is there any questions on the phone?
Governor Mike Tanner with KWAT in Watertown.
Sure, go ahead, Mike.
Hi, Governor. Just a few weeks ago, you were talking about a peak in mid-June and that South Dakotans would need to follow all of the mitigation efforts up until then. And now today you're talking about getting ready to roll out a back-to-normal plan. What has changed over the last couple of weeks?
Well, we'll be able to share more details with you tomorrow. We do have our healthcare systems and that medical task force that I unveiled a week ago, working on new modeling data, new projections for us based on what we're seeing here in South Dakota on the ground. So we'll be able to update the public tomorrow with those finalized numbers to show why we're making the decisions that we're making. And I just want to remind everybody that we continue to remain steadfast in making our decisions based on the facts and the data. So when I make recommendations to the state of South Dakota, it will be looking at the science of the virus, what we've learned about it, and then also the facts that we see here in our state and how our population is being impacted.
And then a quick follow-up, if I could. Is the plan to continue moving forward with the temporary hospitals in Sioux Falls and Rapid City? And if so, do you think that they'll be needed?
We are prepared to move forward with some of that build out on capacity, and we're continuing to evaluate to see what would be necessary to adequately take care of folks here in South Dakota. If you remember, there was a plan to put in place some more facilities in Rapid City and in Sioux Falls, and those are the areas that we'll look at. Every single healthcare facility in the state was looked at for surge capacity, adding beds underneath their roof and what they already have. And so that's a part of all of this logistical planning that needs to happen when we rework our projections for what's going to happen in South Dakota.
Governor Lee Strubinger, SDPB.
Sure, go ahead, Lee.
Thank you, Governor. I wondered if you had any thoughts about what Senator McConnell said last week about not using federal aid to bail out states. And is that federal aid something that South Dakota might need, or is South Dakota's position something different? I just wonder if you had any thoughts on those comments.
Well, I had a conversation with Senator McConnell this weekend and talked to him about the state of South Dakota and how our budget works, the decisions that we've made, and how we need flexibility in those federal funds. We have a very thrifty state government, and we have a state constitution that requires us to balance our state budget. We have a AAA credit rating. We make good decisions, and really our fundamental source of revenue for taking care of people is sales tax, and that was dramatically impacted when the president recommended that people stay home for 15 days. Even though it wasn't mandated in our state, people did, and they took it seriously. 80% of my state budget funds health care and education. So what I talked to Senator McConnell about was just how yes, the federal government stimulus package did send us $1.25 billion, But if I can't have some flexibility to utilize that to take care of some revenue losses that we've seen, I may literally be leaving tens, if not hundreds of millions of dollars on the table while simultaneously making huge cuts to education and the funding of nursing homes. And I don't think that's what Congress intended. I know that they know that state governments are on the front lines of taking care of people during this COVID-19 virus spread across our states, and that they meant to help. And so having some language put in statute that would allow us to be accountable, to make sure that they're tying it specifically to revenue losses, to help make sure that we can keep our resources out there taking care of people. That would be extremely helpful for them to do at this point in time so that we're not faced with those impossible decisions.
Do you think that would
Governor
be...
JP at KORN News Radio, if I could follow up on that, at this point, what do you believe the chances are that we could get a favorable decision and relax some of those restraints that have been put on the federal aid that's been given to South Dakota?
Well, JP, I've been pretty outspoken. I've been visiting and making phone calls to those in the Senate, in the House, in the administration, also in Treasury, but also talking to the people of South Dakota and then talking about it openly in the media to get that message across. So there are some folks that are really starting to understand the impact that's happening to states. I understand their desire not to want to bail out states that maybe have bad pension funds or have overspent in years past. What I have talked to them about is that there's a way to build accountability into it to allow us to use this to meet needs, showing and proving that we directly were impacted by the virus, and to let us use some of these revenues for that. What I've told everyone is that I don't want you to go spend more money. I'm not asking for more money from the federal government. What I'm asking for is just the flexibility to use the dollars they've already spent to make sure that I can still take care of people.
Thank you.
This is Morgan at the Rapid City Journal.
I'm going to take a question in the room and then I'll go back to the phone.
Could you clarify the amount, because you said 1.25 billion, and there are other reports that it's 1.57 billion. What's
The other reports would be adding in money that maybe came straight to the state but not to the state government. There's also some dollars that went to education, such as higher education, direct funding that goes to them that they will utilize, some to healthcare organizations. But the amount that was transferred to the state was $1.25 billion in direct relation to our allocation from the stimulus bill. Is there a question on the phone?
Yeah, this is Morgan at the Rapid City Journal.
Sure, go ahead.
Will any of that $1.25 billion in federal coronavirus aid go towards paying for testing for those who may be uninsured in the state, or for the cost of testing in private labs for patients?
Yes, there is help to pay for testing. There is some availability there as well. What is happening in South Dakota is people who want and need a test in consultation with their doctors have the ability to do so, and I can let Kim speak directly to how that funding source is happening for those whose resources may be very limited.
So this is Kim. In the case of people that don't have insurance, if they need to be tested for COVID-19, then the state public health lab will process that test at no cost to the patient. So that's a way that we can kind of support that group of people getting the testing that they need. We also have clinics, federally qualified healthcare centers that are across the state that serve people on a sliding fee scale, and so that would be a resource for folks without insurance as well.
Governor Chris Dancy at News Center 1 in Rapid City.
Sure, go ahead.
As you may know, the city government here is considering a resolution at a special meeting this evening to begin easing restrictions on some of the businesses here. Was wondering, are you familiar with that plan, and do you have any thoughts on them proceeding at this point?
I am not familiar with the details of that plan yet. I do know that they were considering easing some of those restrictions, and that is certainly something that they have the ability to do. Tomorrow I will lay out some of my guidelines for how we start to get back to normal and what the time frame will look like and what needs to happen in order for us to start making changes on what I'm recommending from the state government. But I do know that many cities, as they made decisions across the state, put in place ordinances that may have been more restrictive than what was happening at the state level, and from what I understand, some of them are pulling them back to allow businesses to reopen and to allow people to facilitate customers in a way that they haven't before. So I think that is certainly something that they have the ability to do, and I know that many of them are debating right now.
Thank you, ma'am.
You bet. Any questions on the phone?
Governor, this is Amy Furletti at the AP.
Yes, go ahead, Amy.
I'm just wondering, do you know when, or do you have a hope for when the Smithfield plant will reopen? And when it does, will your office or the state be providing some oversight of CDC recommendations?
Well, we are hopeful that they will open as soon as possible and as soon as it is safe for their employees to be working there. We will be supporting them in testing and making sure that those guidelines were put into place. We all have the CDC report, and that's what we're looking for to be fulfilled. But our hope is that that plant can get back up and online as soon as possible, considering its critical infrastructure and vital to our nation's food supply.
Could it happen this week?
I hope would be. It's up to Smithfield, really. At this point, the ball is in their court.
Thank you.
Governor Patrick Callahan, South Dakota Broadcasters. Follow up to that, have you had any further conversations with Smithfield and the Virginia headquarters since the release of the CDC report?
You know, our team has been having conversations with them. I have not spoken to Smithfield myself for the last 24 hours. I'll see if Kim has an answer to that.
So Dr. Josh Clayton and I had a call with Ken Sullivan with Smithfield on Friday to talk through what they anticipate their next steps to be. They indicated that they are working on looking at the report that the CDC provided in great detail, and we are hopeful that they will be providing us more information this week to take a look at what they plan to change and how they plan to move forward.
And if I could follow up on that, did they have any disagreements with the CDC report that they discussed with you?
I wouldn't say disagreements. I think they recognize that with the physical layout of their operation, that some of the recommendations are harder to accomplish than others. But I think we definitely have a shared goal of making sure that the plant reopens and is safe for people and continues to operate.
This is Lisa with the Argus Leader.
Sure, go ahead, Lisa.
Yeah, just wondering on the Smithfield topic, just wondering if once it reopens, is the state going to plan any sort of enforcement actions to make sure it's continuing to take action to kind of curb the spread of it? And is there going to be any mechanism for workers who may feel there's issues in the plant, if they could go to DOH or something like that?
Lisa, this is Kim Alsam-Risden. So yes, we would like to continue to support Smithfield after they're up and running to make sure they've got the kinds of equipment and procedures in place that keep people safe, and so we would expect to be able to do that. Relative to workers that have questions, there is an active union in that particular work site, and so they've been a resource to their employees, and we've had conversations with union reps at the Department of Health level, and so feel like that could be a good venue moving forward to make sure that workers' issues are being addressed.
Okay.
And Lisa, I would just note as well that we have been helping Smithfield secure their necessary personal protective equipment as well that they need for their employees. So when there is a role that we can fill to help facilitate this, we've been actively doing so.
Okay.
Go ahead, Lee.
Thank you. The BIA sent the Cheyenne River tribe a letter over the weekend with concerns about Highway 212, and I know you've talked about it before, but I just didn't know if anything had changed since you'd last commented about how the tribe was handling that, and do you have any concerns currently?
Well, we're working with the Department of Interior, the BIA, and the Department of Justice on the issue. It's not accurate to say that Cheyenne River consulted with the state of South Dakota before they set up these checkpoints. That simply was not true. And it did indicate in that letter that they should be working with us. We don't believe that that is, we stand there ready to have conversations, but that is not something that the tribe has engaged in. So we're sending a letter back clarifying some of that misinformation and making sure that they know that we're willing to be a part of the solution. Any further questions? Okay, thanks so much. We'll see you tomorrow.